Hello everyone, welcome once again to another episode on Health Talk with Fiifi. My name is Aja Duma Ansa, and today we are going to look at some misconceptions and myths surrounding breast cancer. Kindly like, comment, subscribe, and also share this video to your family and friends. Connect with us on all socials at Health Talk with Fiifi. Now let's get into today's video. Breast cancer. So we looked at breast cancer in our previous video. Now today we are going to look at the misconceptions and some myths surrounding breast cancer, as I said earlier in my introduction. So breast cancer, one of the most common diagnosed cancers worldwide. It is surrounded by numerous misconceptions and myths. These false beliefs can lead to unnecessary fear, misunderstanding, and in some cases, delayed diagnosis or improper treatment. Now, addressing these misconceptions is crucial for enhancing public awareness, promoting early detection, and also improving overall patient outcome. Now, let's consider some myths or misconceptions surrounding breast cancer. Now, the very first myth to breast cancer or surrounding breast cancer is only women get breast cancer. Now, let's consider the fact to this myth. While breast cancer is more prevalent in women, men can develop it too. Men have a small amount of breast tissue, making it possible for malignant cells to form. Although it is rare, breast cancer in men tends to be diagnosed at a later stage, possibly due to lack of awareness or vigilance. It is essential for both men and women to be educated about the potential risks. The second myth, breast cancer always presents as a lump. Now, the fact to this myth is, a lump is a common symptom of breast cancer, but not the only one. Other signs include skin changes, redness, dimpling or thickening of the skin, nipple discharge, pain, and changes in the breast size or the shape. Relying solely on the presence of lump can delay diagnosis. Therefore, awareness of a broad spectrum of symptoms is very critical when it comes to breast cancer. 3. Family history is the biggest risk factor. Now, the fact to this myth is, while having a family history of breast cancer increasing the risk, most people diagnosed do not have a family history of the disease. According to World Health Organization, around 85% of breast cancer occurs in women with no family history. Other factors such as age, hormonal exposure, lifestyle changes, and certain genetic mutations play a significant role. 4. Wearing a bra, especially underwear, increases breast cancer risks. Now, the fact to this myth is there is no scientific evidence that wearing bras, whether underwear or not, increases breast cancer risks. This misconception is based on the theory that bras restrict lymphatic drainage, leading to toxin buildup. Research has debunked this claim, showing no correlation between bra type or wearing habit and cancer development. 5. Older women get breast cancer. Now, the fact to this myth is age is a risk factor, with the probability of breast cancer increasing as a woman gets older. However, young women and even adolescents can develop breast cancer. Although it is less common, younger women may face more aggressive forms of the disease and sometimes experience a delay in diagnosis just because of the assumption that breast cancer only affects older women. 6. Breast cancer is always hereditary. Now, the fact to this myth is while breast cancers are hereditary, which is linked to the gene mutations like the breast cancer mutation 1 or breast cancer gene 1 and 2, the vast majority are sporadic, meaning they occur without a known genetic predisposition. Environmental factors, lifestyle choices, and random genetic mutations also contribute to significant risks of cancer. 7. Mastectomy is the best way to treat breast cancer. Now, the fact to this myth is treatment varies depending on the type, stage, and characteristics of the cancer. While mastectomy, that is the removal of the breast, is one option, many women are successfully treated with lumpectomy, removal of the tumor, and chemotherapy, sometimes radiation or targeted therapies. For some early stage cancers, lumpectomy combined with radiation offers similar survival rates as mastectomy. A healthy lifestyle guarantees you won't get breast cancer. Now, the fact to this myth is, although a healthy lifestyle, that is maintaining a balanced diet, exercising, avoiding tobacco, limiting alcohol, can lower the risk, it does not eliminate it. Breast cancer can affect anyone, regardless of lifestyle. Staying vigilant about screening and paying attention to any unusual changes in the breast are essential for everyone. Even those with healthy lifestyle or habits needs to monitor these changes. So regardless of your healthy lifestyle or habits, breast cancer can affect anyone. If you have no symptoms, you don't need screening. Now, the fact to this myth is breast cancer can be asymptomatic, especially in its early stages. This is why screening tests like mammograms are critical. They can detect cancer before symptoms develop, often when the disease is most treatable. Regular screenings, even in the absence of the symptoms, are a key strategy for early detection of breast cancer. So it is not true that if you have no symptoms, you don't need screening. Antiperspirants cause breast cancer. Now, the fact to this myth is there is no conclusive evidence linking antiperspirants or deodorants to breast cancer. This misconception stems from the idea that chemicals in antiperspirants, like aluminum compounds, are absorbed through the skin and interfere with lymphatic drainage. However, research has not shown any definitive link between antiperspirant use and an increased risk of breast cancer. These are some of the myths surrounding breast cancer and the fact to the various myths. Thank you so much for staying with us on today's episode about myths surrounding breast cancer, and I know you are informed and educated with this video. My name is Ajah Duma Ansah. Kindly subscribe, like, share, and comment on this video, and also follow us on all socials at Health Talk with Fiifi. This has been Health Talk with Fiifi. See you same time next week. Bye.